Please note, today's session is being recorded. If you have any objections, you may disconnect at this time. Thank you very much. On behalf of the National Cancer Institute, I wish to welcome everyone to this pre-application funding opportunity announcement webinar. Before we get started, a brief word about logistics. We ask that if you are not already on mute to please keep your phone on mute for the duration of today's presentation. As mentioned, the session is being recorded and muting all lines will help us to avoid any background noise. We encourage questions. They can be submitted by using the Q&A feature on the right-hand side of your screen. Please type your question in the provided Q&A field and hit submit. Feel free to submit your questions at any time during today's call. We will begin answering questions after the brief presentation. A number of questions have been submitted in advance of today's session. We will be answering those at the beginning and then moving through the rest of the questions. We may not have time to address all questions during today's session, but an FAQ will be created from all submitted questions to today's session and then posted on our website approximately 1 week after the ending of this recording. And with that, I will turn it over to Cindy and April.
Good afternoon. This is Cynthia Vinson, and I am here with April O.
Hi, everyone.
And we are excited to talk with you about this funding opportunity. The implementation science centers that you are all here and are interested in learning about came about because of the Cancer Moonshot. There, as many of you have heard, have seen, many of you may have been at the DNI conference a couple of weeks ago, or you may have watched the BSA presentation that David Chambers gave. This is just an overview of why we have these centers. There was an implementation science working group that made recommendations, and you can see here that we really do believe that if we can increase the uptake of evidence-based cancer prevention and screening programs, specifically among the underserved populations, that we can have an impact on cancer outcomes. And you can see here that we believe, scaling up the efforts that we know work can impact cancer cases, and we can have fewer cancer deaths. And that came out of the working group report from the Cancer Moonshot, which I like to say really shows that implementation science time has come, that we are able to find funding opportunities and develop these funding opportunities at this critical time is great and is able to be seen from this Cancer Moonshot report. We've been working on trying to move cancer research into practice for many years. In 2003, we launched the Research Tested Intervention Programs website. And as of today, we have approximately almost 200 programs. Those programs are ready to be implemented as evidence-based interventions, and we know there are evidence-informed interventions from the community guide and from other sources that are also ready to be implemented, but we don't know if they are being implemented, how they are being implemented, and that is where the work that we are proposing to do and support comes in. We need implementation science to really help improve the population benefit from these interventions. This is a slide that's used quite frequently from our team, and we don't have animation available on this WebEx, and if we did, you'd be able to see. Oh, do we? Oh, Sarah is pointing at me. You'd be able to see a little bit of how we normally present this. Typically, we say that the research that NCI funds focuses, I'm going to actually go back one, focuses on the left-hand side of this screen on the what, understanding which cancer control interventions work, and we're focusing on the health outcomes, the far right-hand side. But what we're really interested in is understanding the how, the implementation happens, and also understanding the research methods and implementation so that we can have a greater impact and increase the number of evidence-based interventions that are put into practice. We see that there are many needs in implementation science, and specifically for scaling up implementation science. And these are listed here. We think that leveraging existing clinical and community sites where cancer control interventions are delivered is important and should be looked at through an implementation laboratory, which is something that we have built into this funding opportunity and we will be talking about in a few minutes. We believe that scaling up implementation science is important and that we should be able to focus on development and execution of natural experiments and rapid cycle testing in order to meet this need. We also need to be focusing on valid, reliable, and pragmatic measures of implementation constructs that are not currently available. And this Implementation Science Center's funding opportunity is designed to help address this area. These centers are not going to be funding R01's level or R01 level grants. What we're really wanting out of this center is the generation of pilot studies in new areas of implementation science. And we've given some examples here that these new areas might be the implementation of precision medicine, de-implementation, local adaptation of interventions, etc. Through this network, we intend to provide nationwide support for implementation scientists in cancer control. This means that we will be providing annual meetings, education and mentoring support, technical assistance on proposals, a collaborative community of practice where folks can share innovative study concepts. There are two types of centers that this funding opportunity is going to fund. The first are what we're calling developing centers. Now, we've talked about this in detail, and we want to make sure that folks are clear the difference between the developing centers and the advanced centers. Developing centers don't mean that we want to fund investigators that are just developing their skills in implementation science, but the developing centers really need to be focusing on emergent, less well-developed concepts in implementation science, where the pilot programs that they are developing are considered to be of higher risk, but also have a higher reward in their outcomes. They're going to be overarching in their theme. They need to frame the activities of each component around this developing concept. And their laboratory, because it's a developing center, is going to really need to be scaled appropriately to answer the questions from their pilots. The advanced centers are focused on more established areas of implementation science. So these are areas where scale and refinement of the existing scientific and methodological areas of implementation science are able to be achieved. And their activities need to be organized in this center around a grand challenge. They need to frame their activities, just like the developing center, around their proposals, and they need to leverage existing efforts in clinical and community sites where implementation science can be rapidly tested and advanced. Two different types of centers that are going to be awarded at different levels. This is a brand new funding opportunity where clinical trials are optional, and we are going to refer back to the fact that people need to be looking at the clinical trials information on the NIH website. You all know that this is for a maximum of 5 years. Developing centers, we are going to be funding them for $3 million in fiscal year 19 at $600,000 direct costs per year, and we're anticipating awarding approximately 3 awards in this round. The advanced centers are going to be coming in at $5 million in fiscal year 19 at $1.2 million direct costs per year, and we can fund up to 4 awards, and all of this is based on the quality of the applications that we receive. There are key dates, and I know you're all very aware of this. There's a lot of activity happening at the beginning of the year. The letters of intent are due on January 11th. We're going to give you some information later on in the webinar about some of the things we want to see in the letter of intent. Applications are due on February 11th at 5 p.m. at your local time. We'll be reviewing these applications through scientific review in April or May of 2019. They'll go to Advisory Council in August, and we anticipate the earliest start date for these centers to be in September of 2019. So we have some key definitions that we want everyone to be aware of. Implementation science, the implementation science definition is the definition that NIH uses in implementation science. It's in all of our funding opportunities. And the ISC3 program, as someone at our D&I conference referred to as ICE Cube, really refers to the combined activities of both the developing centers and the advanced centers, along with staff at NCI that are going to be working to advance the science of implementation in cancer control through their pilots, the field capacity development, their laboratories, the methods and measurement projects that they are going to be developing, and the consortium activities. The implementation laboratory Each center needs to have an implementation laboratory, and this is a collaborative research concept. They are going to reflect what the center awardee is focusing on, and it can be a community and or a clinical site where real-world research can be done. It should reflect the diverse settings that are being proposed from the center's theme, and the research needs to be consistent within that theme. The laboratory is going to evolve throughout the 5 years and needs to enable a range of studies that can cross the implementation science topics shown here, across adoption, implementation, sustainment, and de-implementation. Studies within the lab can cover the full continuum from observational, experimental, and or quasi-experimental. I'm going to turn this over now to Dr. O, and she's going to talk about the organization of these centers. Here you go, April.
And before April gets started, as a quick reminder, you can submit questions at any time during today's presentation. Thank you for those who've already taken the initiative. Feel free to type those in the provided Q&A field and hit submit, and we'll start reading those out to the group once April's finished her portion of the presentation.
Great. Thank you so much, Sarah. So while you're queuing up for those questions, I'm going to go through how the RFA components. So for both the developing as well as the advanced centers, we have a similar organization that we have specified within both RFAs. Unlike other P50 applications, for those of you who may be more senior investigators who have had experience with P50s or other U mechanisms, this P50 is a bit different. So I do want to go over some of those core components and also encourage you to all review the RFAs carefully, as all that we're presenting here is actually listed there. So we expect that the centers will have an administrative core, a research program that includes within it an implementation studies unit as well as a methods unit, and then the implementation laboratory, which Cindy described. So for the administrative core, within the administrative core, we expect to have information in the application that describes the plan for management and integration of center activities, communications, evaluation of progress. We expect to see a timeline, key milestones identified, an advisory board. And the other piece that we've gotten questions about, and I do want to highlight, is there is a network unit as well as an evaluation unit. And within the network unit, the goal is to lead, the network unit would lead the connection between the ISC3 or IceCube centers and the IS field of researchers. So this would include dissemination activities of research findings across centers and the broader community, research capacity building, collaboration, annual consortium meeting, and other workshop participation. We also expect to see a plan that describes how activities at the centers will be evaluated. Within the research program, this is where we will find the implementation studies unit as well as the methods unit. Within the research program, we want you to specify the goals of the research program, explain how the research program will, through the implementation studies and methods unit, contribute to development and oversight of implementation science, pilot studies, methods, and measurement studies, keeping in mind that each center should have an overarching implementation science theme. And the research program should be linked back to that theme, and it should be very clear in your application how the studies are in support of that theme. As you're putting your application together, please keep in mind that you should note how the studies relate and support one another, as well as how studies, as well as other studies within the other units, for example, in the methodology unit. Consider how the studies are linked to the theme, and also include plans and consideration of how measures collected will be part of developing a center data ecosystem. Within the implementation studies unit, there is a specification for developing centers to have one study, as well as 2 additional innovative study concepts related to the center theme that are smaller in scope. For the advanced centers, 2 studies, and at least 2 additional innovative studies that, again, are linked back to the concepts of the center. Include in your application the process for developing, reviewing, choosing, and managing these additional studies. The expectation is that the unit will continue to develop additional pilot studies throughout the funding period. For the methods unit, For the methods used in the developing centers, we expect at least one methodologic study. In the advanced centers, at least 2 methodologic studies. Be sure to specify the goals and how you will ensure that the goals are met for this methodology unit. How will the methodology unit contribute to individual research studies, and how will it function as an incubator for innovative approaches to studying implementation science while working within the laboratory, the implementation laboratory. What I have here is some of these specifications as a screenshot from the actual RFA. And I recognize this is a busy slide, but part of the message here is that we have been very careful and particular in specifying what we'd like to see within the application to be responsive. So please look at these criteria listed here, as well as evaluate and look at the evaluation criteria that are also listed at the end of both RFAs. And the same goes for the methods unit as well. And you will see that there are a couple of highlighted areas. I'd also like to highlight the operational support that's offered of implementation pilot studies that the methods unit would provide. So for the implementation laboratory, this is the third major component of the application. As Cindy described what the implementation laboratory is, we have a lot of really specific evaluation criteria around the implementation laboratory, so I do encourage you to take a look at that. But be sure to think about and state the laboratory overview, leadership, how a laboratory site is considered as part of the membership of the laboratory. Include a data management unit. How will that unit coordinate with the center to support data collection, IRB, data safety and monitoring, data sharing across the lab, and continuous plans, communications plans for continuous feedback between the lab and the PIs. Also include a practice surveillance unit. This practice surveillance unit serves in the role of monitoring ongoing implementation activities to inform those future IS studies, pilot studies that are part of the research program. Now for some tips with your application. Please be sure to read the full announcement for the center application that you're applying to, whether developing or advanced. For experienced investigators, the structure is likely different from what you may have been used to. Pay careful attention to the clinical trials requirements. This is a clinical trials optional. Become very familiar with the NIH definitions for clinical trials, and you as a PI have to determine if your study and application, it qualifies as an NIH clinical trial. Develop a cohesive narrative for your projects that clearly demonstrate how projects and activities relate to the overarching implementation science theme. Don't forget your letters of support for your implementation laboratories. Pay careful attention to the evaluation criteria for those. That's going to help you also in thinking through how you're going to organize. Identify the right team and expertise needed and engage them early in your writing. And please be sure to evaluate that review criteria at the end. Here's some important websites. I want to note especially that clinical trials website that you should get familiar with and use that to determine whether or not your application is a clinical trial. As Cindy mentioned, we have a deadline coming up on January 11th for those of you who may choose to submit a letter of intent. It is not required and is not considered part of your application process when it's reviewed. However, if you do choose to submit a letter of intent, you may also send a short paragraph description of your proposed center. We're using this information for administrative purposes, and again, it will not be included as part of your evaluation for funding. So thank you for your attention, and now we will transition to the Q&A component of the presentation.
So I'm going to go ahead and answer what so far has been our most popular question. So yes, this session is being recorded and will be archived on our website. We will be making the slides and the FAQ available shortly. We just have to turn those things around. I would go ahead and note that there is contact information listed on this slide. If you want to reach out with questions or with your letters of intent, there's email addresses for both Cindy and April. And thank you so much for everyone who has submitted a question. We are going to get started with some that have been submitted online.
Yes, and I just wanted to add onto the last slide about the letters of intent. When we're talking about, let me go back. When we're talking about letters of intent, they are not required. And the administrative processes, it will help us try and figure out the types of reviewers that we need, the numbers of reviewers, et cetera. So it just helps us prepare to make sure that there's a quality review, since these applications are going to be going through a special emphasis panel. So
let's do one and one. So
sure.
let's start with the questions been submitted in advance, and then we'll jump into those being submitted real time.
Sure. So April, this was one of the first questions that was submitted online. Does the program have clear expectations about the organizational structure of the submissions and whether PIs need to have roles on all components of the proposed center? Can the PI that's leading the admin core have a smaller role on the methods unit, for example?
Yeah, so this is a great question. Center PIs have the ultimate flexibility in determining the organizational structure of the center. This was done on purpose. You are coming up with your implementation science center theme, and to answer and achieve your research goals related to that theme, we want the PIs to be able to structure the center as would be most, allow for most success for your center. A P50 can have multiple PI or PDs, and so therefore the admin core and research program could have different PI PDs. But please do note that a contact PD for the application will have to be identified. And that contact PD would be, if your grant is funded, would be the listed contact PD in, for example, NIH Reporter. However, if you do go into the file, the other PIs or PDs that are listed as having responsibilities within the center would also be listed. So please work closely with your grants office regarding the PD, PI designations for your application.
Okay, great. So our first online question reads, the RFA states that all advanced centers should be organized around an overarching, quote, grand challenge implementation science theme. Do these refer to the list of possible themes outlined in the RFA or something else?
So yes, they refer to those overarching themes outlined in the RFA, but those are just examples of potential overarching themes. What theme a center chooses is up to each individual investigator that's submitting. We've also provided and have a link in the FAQs that we're going to be posted to the implementation science or to Reporter, where you can search for the types of studies that have been funded by NIH related to implementation science, and that can help you get more information about potential topics for implementation science. So it's not a pick or choose the themes, but those are provided as a way to get your juices flowing and thinking about the types of themes.
Wonderful.
All right, so Cindy, I have another question for you. So may key personnel or co-investigators be involved in pilots as well as other aspects of the proposal?
Absolutely. I think kind of that refers back to the question that you just responded. Mm-hmm. The investigators can be very flexible on how they're involved. You just need to make sure that you're including them as appropriate in bio sketches, et cetera. But key personnel can be involved in pilots and methods units in the laboratory, et cetera.
So do you want to tag this one on? Because I have a thing that folds into this.
We'll tag on to this. So related to that, Cindy, should bio sketches for faculty who will receive D&I research mentorship as part of the center's activities also be included in the application?
We don't specify that faculty that are going to receive the mentoring need to be listed. However, if those individuals if they have a specific role in the research program, such as being in the admin core of the laboratory, then yes, their bio sketches would need to be included in the application. So these P50s aren't set up to have specific training mechanisms for mentoring, et cetera. And if you're thinking about training, you need to explore the R25 or other funding mechanisms for that.
So to add on to that, it appears there can be multiple PIs. Can there be co-directors on cores and or multiple PIs on pilots?
Say that again, please, the last part. Co-PI, multiple PIs on pilots?
Correct. So it's an and/or. So in the space of having multiple PIs submit, can there be co-directors on those cores or multiple PIs on submitted pilots?
Yes.
Great.
This is a multi-PI PD mechanism, and so if this person or this center chooses to structure your center in that way, then you may do that. However, I will note, you will have to justify that in your budget. You will have to justify that all of that expertise is required and needed for that team to be able to accomplish the goals of the center. So carefully look at your team, make sure you have the right expertise, and then evaluate it that way, and also look at your budget and organizational structure. Great question.
Perfect. Let's jump to another pre-submit.
All right, April. So this has to do with early stage investigators. If an early stage investigator is the implementation pilot leader, would the policy regarding ESI applications with meritorious scores be prioritized for funding count towards this pilot study?
So great question. No, unfortunately, the ESI policies do not apply to being the lead on an implementation pilot study. The ESI policy, that really applies if an individual is the contact PI on an NIH application, and that's typical for other mechanisms like an R01. For this P50, the ESI policy is not, this P50 does not include the ESI policy, and we can share a link to the NIH policy around early stage investigators as people are interested. Next question.
Okay.
So I'm going to combine two years. They seem to go together quite well. It reads, for developing centers, please clarify what is meant in that the implementation laboratory should be scaled appropriately and how that might evolve over time.
So scaled appropriately means these developing centers are going to be addressing high-risk, high-reward questions. The budget for these centers is smaller than for the advanced centers. So the laboratories need to be the size that is appropriate for answering the question in the developing center. And it needs to, all of the laboratories need to be able to evolve over time, because we're expecting over the 5 years to explore additional research questions. It's not expected that you're going to be having one pilot in the laboratory and then one in the method section for the entire 5 years, and you're going to be discovering new information, and you need to be able to evolve in your laboratory to address those issues, which may mean you need to have some flexibility in how those laboratories operate.
Great. Okay, Cindy, I have another question for you. How is program defining cancer control? Can implementation studies be proposed to span the cancer continuum from prevention to control, or is program's emphasis on studies of cancer patients, either survivors or those currently on treatment?
This is actually a terrific question, and I think a place where some folks get caught up. So NCI really defines cancer control as the science. Cancer control is the science. Cancer control science, is the conduct of basic and applied research in the behavioral, social, and population sciences to create or enhance interventions that independently or in combination with biomedical approaches reduce cancer risk, incidence, morbidity, and mortality, and improve quality of cancer life. So for these activities, the applicants for this center really need to think about the central implementation science question that the center is going to be examining in selecting their theme. The theme needs to be an implementation science-focused theme and should serve as the frame of the activities of the center's components, as well as their research agenda. The theme can expand and build across the cancer control continuum in implementation science. So it's implementation science across the cancer control continuum. It does not mean that it needs to be for a specific population. It can be community, it can be patients, it can be systems. So it's really going to depend on the implementation science research questions that are being proposed.
Great, thank you.
Let's jump to another online submission. So this reads, How are the implementation science outreach and network unit different and similar? I thought there was a fair amount of overlap between these two.
We're pausing for a moment. Hold on. Looking at our notes. I'm going to give my take on this, and April can correct me. The network is really focusing on connecting the centers and building the field of implementation science, and outreach is pushing out beyond those members involved in implementation science and the consortium that will be developed.
Yeah, great. That's perfect, Cindy. And I would just add that in the admin core, we're really looking for a network unit as well as an implementation science unit and a in the administrative core, we're looking for a network unit. So there's no specific outreach unit, but there is within the administrative core responsibilities for outreach. And so for the outreach, you're really looking at potential opportunities to grow the field, as Cindy mentioned, within the institution of your center and across the network of funded centers.
And I would say even beyond the funded centers, because the ultimate vision for the implementation science centers is to develop a self-sustaining consortium in implementation science that goes beyond the number of centers that are going to be funded. So over time, we hope that there will be other organizations that are engaged in this as well. Great. Okay. Hold on, we'll go to the next question.
Great, so for both April and Cindy, how narrowly should themes be defined?
So the scope of the theme will depend on the type of center, whether it's developing or advanced, and should unify the proposed activities for each component of the application. So we have within the RFA some specific language that the theme should frame activities of each required center component and the research agenda that the center will complete. The laboratories should help to achieve that theme, and centers will identify an overall scientific theme which will include specific goals, like some of the examples that we have in the RFA. So some potential theme areas for the developing center to focus on are, for example, advancing implementation of precision medicine across the cancer control continuum, optimizing scale-up of cancer control policies and interventions, de-implementation. Potential themes for advanced centers to focus on could include, but aren't limited to, developing and testing implementation strategies for evidence-based cancer control interventions in areas like tobacco control, HPV vaccination, or cancer screening. Another example might be advancing the implementation of evidence-based symptom management across the cancer continuum. All right.
So to jump to one of our submitted questions. Sorry, I want to go in the order they're being submitted, so I appreciate everyone's patience. Although implementation science outcomes are to be prioritized, is there an expectation that we also measure health and behavioral outcomes?
It depends on your research question, and you need to be thinking about the evaluation criteria. So review the evaluation criteria within the RFA. I think that that's as much guidance that we can give you on that.
Perfect. And so a pre-submit.
So Cindy, how does program envision the interaction between the implementation lab and the implementation studies or methods unit apart from the funded pilot studies?
So this is part of the innovation of these implementation science centers. There are some key pieces that we expect in these applications. The RFA specifically states that applications should describe how the methods unit and the implementation studies unit are integrated in the service of this research and how the research program will relate to the implementation laboratory. How the pilot studies will synergize with the rest of the center to achieve more than what could be achieved through an independent research study is seen as a component of a proposal's innovation. So there's very specific language of this in the RFA. Subsection C talks about the center organization and integration, and I'd refer everyone to that section of the RFA for more detail. and we'll be posting that specifically on the FAQ. Again, please review the evaluation criteria for the implementation laboratories in the FOA so that you're able to be responsive to the funding opportunity.
Wonderful. So we have another sort of very specific RFA-related question that reads, the RFA does not, said to not name the advisory board. Question mark. True.
True, false, true.
Okay, I was like, that was straightforward.
Yeah. You should, if an internal or external advisory group is proposed, describe the expected required expertise, but no, do not list any names of potential members and do not contact potential members before review.
That's to help us make sure that we can get a quality review and that we don't have people disqualified right off the bat because they are put forth in a proposal. So, please. So the next question, if an organization is planning to submit this P50 proposal for an advanced center, but has also been invited to participate in a separate organization's advanced center application as a laboratory, can they do this? Assuming that the two applications have a different focus or theme.
Great question. So collaborating with another institution regarding the laboratory is allowed, but please note the following. If you do this, document the environment characteristics and or commitments of the participating institutions. As applicable, explain how multi-institutional collaborations will broaden the range of expertise required for a comprehensive transdisciplinary approach to the implementation science theme proposed by the center. An advanced center, we would expect, may consist of several collaborating sites that are not all located in a single institution or geographic region, although it is also okay if they are within the same geographic region or location. The collaboration of multiple institutions and settings to create a virtual center, if you choose to do so, must be specified and explained as well, and so that the feasibility of such arrangement can be evaluated. So institutions that are considering collaboration are encouraged to carefully review the requirements that are outlined for the laboratory, especially the evaluation criteria. And it's also important that applications are clear about the selected theme and do not overlap with the other collaborating centers' applications.
Now we understand that you won't know all of the centers that are funded right off the bat, so you won't know, this is only if you are collaborating as you're submitting the application. It's also important to understand studies are going to be implemented in these laboratories. So the studies are going to be conducted through these laboratories, and I know that there was a question about that. So the question was, are the pilot studies being run by the laboratories? They're going to be run through the laboratory. So.
Okay, great. So let's jump to another submission question. Could you give us more detail on the budget expectations for the annual network meetings? Should travel be budgeted for teams to attend each year, and also costs associated with hosting once or multiple times? Should those hosting costs be put in one particular year?
So the PIs, you have the authority to determine the budget for your application. I would like to note for this question that we do expect that the funded centers would meet annually in person, and that the hosting responsibilities will rotate, so that over the course of the 5 years of this funding, each funded center will have the opportunity to host at least once. So hopefully that helps in terms of budgeting. We would like at least the center PI to participate and travel to all of those meetings, and then we would expect that the core personnel that the center identifies also participate in those meetings in person.
Perfect. So I'm seeing a lot of overlap between questions being submitted and questions that we have slides of, and I think it's maybe helpful to see those. So let's go ahead and run through some more of these earlier submissions, and I'll go ahead and pitch them to you both, okay?
Okay. Why am I not there?
There we go. The RFA notes that applicants must describe at least 2 implementation studies intended to be conducted in the first 2 years of the study period. Does each of these studies need to be funded as a 2-year pilot, or is there flexibility for the pilots to be awarded as 1-year or 18-month pilot projects? Let's stop there and then we'll keep moving.
Sure. So all of the centers have flexibility in determining the timeline for their initial pilot studies, as well as future pilot studies. The initial and future pilot studies need to be noted in the center timeline. However, we generally anticipate that the pilots are not going to exceed 2 years. We know that the implementation study units are going for the developing centers. You're going to have 1 or 2 innovative concepts related to the center theme, and that those are going to be smaller in scope, and the advanced center will have 2 studies with 2 additional innovative studies. So does that help answer that question, or maybe it's getting to the 1 year or 18 months? If you want to propose additional studies during those first 2 years, you have the flexibility for that.
Yeah. And then to speak a little bit to the second bullet, is there a minimum time period required for future pilot implementation studies? Is there an anticipated minimum number of pilots to be supported in years 3 through 5?
Our expectations for minimum studies over the course of 5 years is that for the developing center implementation studies unit, 1 study and 2 additional innovative study concepts. Advanced centers, it would be 2 studies and 2 additional innovative studies. Those are at minimum. For the methods unit, for a developing center, at least 1 methodologic study. For an advanced center, at least 2 methodologic studies.
And that's over the 5-year period.
Perfect.
And you will note on your timeline in your application when those pilots would occur.
Great. Let's jump to the next question.
Oh, sorry. She's pointing at me.
Great.
So I think that this actually was answered in the last response. The methodological research studies, April just mentioned, it's for the developing centers, it's 1 over the 5-year period. For the advanced, it's 2. We expect that these pilots are hopefully going to be building on either the implementation study pilots or existing cancer control programs. So you need to be looking at the RFA to describe how your methods unit's going to facilitate the development and design of these methods and measurement studies, and how they're going to address additional gaps in implementation science and measurement. You should also be thinking about how the design of these studies is going to further research and how they can contribute to the overall focus of the implementation science center. So I think that that's probably sufficient. We'll go into more detail
in the FAQ.
In the FAQ. April. Oh, sorry. Sarah keeps motioning me, and I keep thinking she's telling me to move on.
Well, I think that these are great questions that sort of nest together quite well, and again are speaking to a lot of the questions I'm getting submitted online. So thank you for those who continue to submit those, and we are doing our best to move through all of these. So with this question that you're seeing on the screen, for the pilot project awards, do applicants need to provide a sum total of resources allocated for each pilot with a separate pilot project budget?
So the RFA provides the following instructions regarding budget. Budget forms appropriate for the specific component should be included, and you should outline requested budget for research studies and pilots planned over the course of the center. This budget request may include funding for equipment, software, and computing resources, and expected that the research program should also be the largest portion of the budget for the center. Funds for research supplies and equipment should not be duplicated in other parts of the budget. So depending on your center theme, the type of pilots that you would like to have within your center, you as a center PI and team should be able to determine what that budget is. So related, another question received is whether centers have the flexibility to provide pilot awards through vouchers for discrete services. And again, that's up to the center depending on your theme, your research questions, your goals for the pilot project.
Okay. So can grantees receive an award under this funding announcement used for the NCI Cancer Control IRB as the single IRB of record? So this is getting into some of the weeds here, but the answer is the center that's holding the award needs to submit its own institutional IRB. So we'll provide a link to a single IRB and multi-site IRB in the FAQs that we post online, but this will go through your institutional IRB.
Great. So I'm going to jump to, I have 2 questions online that have been submitted I think we should take. Now the first one reads, different track. Can an implementation laboratory include several different components, e.g. a clinic system, schools, like health worker organizations, or should it only be one, quote, system?
You can go and include, it can't include any and all of those. It really is going to be based on what your research questions are as to who should be incorporated and included in your laboratory.
Okay, great. And so then the other question, I'm sort of backing this out because I'm getting it repeatedly. Let's revisit the idea of the implementation science theme versus the overall grand challenge. Are they one and the same? How do those differ? If we could just do a quick soundbite on that one more time.
The theme is also the grand challenge.
Great.
Thanks.
That's the soundbite. Okay.
Perfect. Let's jump to.
Okay. So this is getting into some of the questions around clinical trials. Would a pilot study that includes randomization at the clinic level qualify as a clinical trial per the NIH definition? So yes, that would be a clinical trial. Center PIs, you are responsible for determining if the proposed research is going to qualify as a clinical trial, and we are going to be providing you with the definition and a link to the grants.gov clinical trials website so that you have the most up-to-date information. It is your responsibility to determine if your study is a clinical trial.
Let me go ahead and just make a quick plug. If you're looking for a resource on that specific to implementation science, Wynn Norton on the implementation science team here has provided a brief overview on our website. That's cancercontrol.cancer.gov/IS, and it speaks a little bit more with specificity to implementation science and clinical trials.
Perfect. Thank you. Sarah?
If the first 2 years of a center's research would not be considered a clinical trial, but the center may want to support pilot projects that qualify as clinical trials in future years, should the application note clinical trials via delayed onset studies, or can the initial application note not clinical trials and be adjusted when the annual progress reports are submitted?
So delayed onset, it really means that human subjects research is anticipated within the period of award, and for this it would be 5 years. But definite plans for involvement cannot be described in the application. It does not apply to a study that can be described but will not start immediately. If your future pilot projects are anticipated to meet the definition of clinical trial, then you should submit a delayed onset study. Because these P50s are award mechanisms that include funds for small projects that will be selected and funded by the awardee, the P50 pilots would fall into the 3 categories of delayed onset.
And we will have a web link that's available in the FAQ, so you can read more about that policy at NIH.
Anything else online, or should I go forward? All right. So how does NCI intend to engage with centers under the P50 mechanism? Is this partnership engagement more limited than under the U mechanisms that are often used for consortium?
So great question. So in addition to administering the grants, the NCI's implementation science team can foster trans-center coordination in terms of data sharing, dissemination, and meeting support. The NCI staff will also actively participate in any consortia-related activities, capacity building for the field, and network activities under the administrative core. That would be specifically the network unit.
Excellent. Are program staff available for calls with PIs to discuss their specific proposals?
Absolutely.
Yes. And for this, we are asking that you email us. The first week of January, we're going to set aside time for office hours, but we want to realize that there are a large number of people that are interested in this funding opportunity, so please send us a one-page abstract. We can't read your entire application, and calls will be limited to 20 minutes so that we can answer everybody's questions at one time. And in a very short period of time, we'll be able to get through this, hopefully. So, April, is a P50 Center that has a population in lower middle income countries eligible for this funding opportunity?
Great question. So because, as Cindy mentioned at the beginning of this presentation, that funding for this initiative comes from the Cancer Moonshot, and it's a domestically focused Cancer Moonshot, a domestically focused center with some global activities that contribute to understanding and advancement of implementation science within the U.S. could be within the scope and goals of the RFA. However, an exclusive global focus would be beyond this RFA, and any applicant who's interested in proposing a globally focused research project can contact any NCI program staff or Cindy and I, and we can advise on other potential funding opportunities that might be available.
Okay, great. So we have now answered all of the questions that were submitted in advance. Thank you all so much if your question got answered in that round. We have about 8 minutes left in the hour. I have some questions. We're going to do a rapid fire round, and then I have some closing logistics. Sound good?
Sounds great.
Perfect. So for future implementation pilots and methods pilots, is it expected that there should be a call for applications and a peer review process for selecting proposals, or could they be developed through an internal collaborative process that is not competitive?
Yes, either. You have to determine what your process is going to be for determining how you will be selecting future pilot studies.
Great. Is it your expectation that pilot studies would be open to all implementation science researchers, or could we limit the pool to researchers within our institution?
That is up to the center, and if this is a multi-site application with multiple institutions, then that could certainly be a possibility.
Great. Is it an expectation that the, quote, additional innovative study ideas be led by a junior investigator? Can I read that one more time?
Yes.
Sorry, I'm failing at the rapid fire.
No.
Is it an expectation that the additional innovative studies ideas be led by a junior investigator?
No, but we do want to make sure that junior investigators are able to get experience in implementation science through this center's consortium, and that there are opportunities for them to take leadership on pilot projects. Doesn't mean that they need to be the PI or the only lead, but that we're helping to bring up and foster training and education for upcoming implementation scientists.
Great. Do the methods pilot and the implementation pilot need to be directly connected to one another, or can they be independent as long as each is connected to the overall theme?
Yes, to both.
Great. Rapid fire. Given the focus on generalizability in implementation science, how, from a conceptual perspective, do you see this enabling more than quality improvement research?
Hard to answer in a rapid fire question.
I like to make it challenging.
I think that that's something that we'll have to take and answer in an FAQ, because I think we need to have a few more minutes to ponder that as opposed to trying to come off.
We'll move on, or that person can book a 20-minute session with either Cindy or April, so keep that in mind. Regarding the, quote, process for developing, reviewing, choosing, and managing additional studies for the Advanced Center, is there an expectation that the Advanced Centers will solicit study pilots which the Advanced Center would fund, the idea being mini grants within the P50?
So I think that question was answered before, and that could be a model that the center uses, but it could also be that you have another sort of evaluation process for selecting the pilots.
Okay, great. And then I think that this is good address. We'll answer one more time, and then
I'm sorry, I'm just going to pause for just a second.
Yeah.
Because the application for the Advanced and Developing Centers do state we want a sense of the 2 pilot studies initial, and then a sense for the plans for 2 additional, you would want to think about that in how you're structuring the evaluation of selected pilots.
Perfect.
Yes.
So with that, I'm going to make a few logistical notes. Thank you for sticking with us through this full hour. So one, thank you both to Cindy and April for all our hard work and brain power this afternoon in answering these tough questions. We have, for those of you who have opted in during the registration process for this session, we have collected your email addresses, and we'll be reaching out to you shortly with an FAQ as soon as it is available that both incorporates the questions you submitted and the questions that were pre-submitted for this session. I would expect to receive that in the next 4 to 5 business days. If you do not receive an email from one of us on the implementation science team with those materials, please reach out. All of our contact information is available online. We are all Googleable. So that's point 1. Point 2, again, this session is being archived, which means that we will have a full copy of both the audio and the slides alongside with the downloadable FAQ available on our website as soon as we were able to turn that around. And that's hosted on our website, cancercontrol.cancer.gov. You want to look for implementation science. And am I missing anything else, I think?
Send an email if you want to participate in a 20-minute office hour with April or I or both of us the first week of January. Actually, I'm going to be in the office the 7th week, the 7th.
Perfect. Any final notes?
No.
Will you push it forward for me? Perfect. Thank you again for joining us for today's webinar. You may disconnect at this time.
Thank you, everyone.